Welcome to the Opportunities for WBC Employee Benefits Enrollment Overview. In this presentation, we'll walk you through your benefit choices for the 2024-25 plan year. Please review this information carefully, along with your Employee Benefits Guide and benefit summaries.
You are eligible for the Opportunities for WBC employee benefit plans if you are a full-time employee normally scheduled to work at least an average of 30 hours per week. Your benefits will be effective on the first day of the month following 60 days of full-time employment. Eligible dependents include your legal spouse, natural children, stepchildren, legally adopted children, a child for whom you are their legal guardian and is your dependent for income tax purposes, or a child who is medically certified as disabled and dependent upon you for support and maintenance. The Opportunities for WBC plan year is from June through May each year. The elections you make will be valid until May 31st unless you have a qualifying event. Some examples of qualifying events are marriage, the birth of a child, or a spouse's job change. If you have a qualifying event and would like to change your coverage during the plan year, you must talk to HR and submit your request to change your coverage within 30 days of the event. The only exception to the 30-day rule is if you become eligible for premium assistance under Medicaid or the Children's Health Insurance Program. In that case, you will have 60 days to make changes to your plan. Opportunities for WBC is proud to provide our employees and their families with an affordable benefits package, including medical, dental, and vision insurance, plus life and disability plans, an employee assistance program, and an optional flexible spending account. We'll start with the medical plans.
It takes a team approach with all of us doing our part as educated consumers to manage healthcare costs and ensure that great care is affordable now and in the future. You can do your part by learning about your benefits and developing a plan about where to go for care when you need it. The best time to get to know your healthcare plan is during open enrollment to ensure that you're selecting the best plans for you and your family. Blue Cross Blue Shield of Texas member portal, bcbstx.com, is a great resource to get to know your medical plan and understand how to use it. On the site, you can review your benefits, search for in-network providers, and you can look up how much a procedure or service.
When you are sick or need medical care, it's important to know where to go for treatment so that you and your loved ones get the care you need. Understanding your options now helps you be prepared when you need to seek treatment and helps you understand how to use your options wisely. Call 911 or go to an emergency room if you have a life-threatening condition. For everything else, see your family doctor first. If seeing your personal physician isn't possible, it's important to know your quick care options, especially before heading to an emergency room. Getting care at the best place for your condition could save you up to $1,800 compared to an emergency room visit. In a moment, we're going to review some brief highlights of the medical plan, but know that more details can be found on the Summary of Benefits and Coverage, or SBC.
The medical plan is offered through Blue Cross Blue Shield of Texas. The most important thing to note is that this plan is not an HMO. This means that you will not need to designate a primary care physician, or PCP, nor do you have to obtain a referral from that PCP in order to see a specialist. This plan contains in and out-of-network benefits. If you seek care from within the Blue Choice PPO network, you will see the most savings. Out-of-network benefits are available, but at a much higher cost to you, so please make sure to check that your provider is contracted within the Blue Cross Blue Choice network before you go. On this plan, the deductible applies to things like surgeries, hospitalizations, MRIs, CT scans, etc. However, for more simple or general care such as office visits and routine lab and x-ray, co-payments will apply. Once you pay your deductible, Blue Cross will pay 80% of the remaining charges, and you will pay 20%. This is called coinsurance. Your 20% coinsurance does have a cap, however. Once your deductible, coinsurance, and copays reach the out-of-pocket maximum, Blue Cross will pay 100% of your eligible charges for the remainder of the calendar year. The out-of-pocket maximum on this plan is $4,500. Deductibles and out-of-pocket maximums are higher for families. Any amount that you pay towards your in-network deductible from October 1st through December 31st will be applied to your in-network deductible for the next year. The plan covers an annual preventive visit for you and your covered family members at no charge. The opportunities for WBC medical plan.
The previous slide mentioned that preventive care is covered at 100%. Here are some examples of screenings and services available at no charge for you and your covered family members.
You can search for medical providers online at bcbstx.com or by using the Blue Cross mobile app. Once you're enrolled with Blue Cross, the system will automatically search for contracted providers within the Blue Choice PPO network. If you'd like to explore providers before being enrolled, go to Blue Cross's provider lookup tool and select the row which reads Blue Choice PPO. Don't assume that everything your doctor orders for you will be covered just because your doctor is covered. Your doctor might order a blood test and send you to a lab in the same building, but that lab may not be covered by your plan. If you see a doctor or other provider that is not covered by your health insurance plan, this is called out-of-network, and you'll have to pay a higher portion of the medical bill, and you could be balance billed for anything over the allowable amount. It's a common misconception that your doctor will ensure that all of your care is performed by other contracted providers. However, this isn't the doctor's responsibility, it's yours. So you can plan ahead to avoid or minimize out-of-network costs. Before you go to a doctor or a hospital, it's always a good idea to call and ask if they take your plan. Tell your doctor in advance that you only want to use other in-network providers and check with Blue Cross to make sure that they too are in the Blue Choice PPO network. Keep in mind that if you pick a hospital that is in-network, you could be treated by doctors who aren't. So ask the hospital to see that any doctors assigned to your case are in the Blue Choice PPO network. Finally, whenever you use the provider finder on the mobile app or at prescription drugs are one of the most costly elements of a group health plan. Helping to reduce costs for opportunities for WBC may lead to lower premium increases in the future. There are 6 different drug tiers. Generic drugs are sometimes 80% less expensive than a brand name drug. Generics are therapeutically equivalent to a brand name drug and must meet the same stringent FDA standards. The preferred brand tier consists of the vast majority of low-cost, high-quality branded drugs. Next to generics, your employer prefers these medications because they are safe, effective alternatives to others that are more expensive. Non-preferred brand name drugs are high-cost medications, and specialty medications are often injected or infused. Remember, choosing generics can result in substantial savings for both you and your employer. Take advantage of the mail order program for long-term prescriptions for chronic conditions. This program lets you order a 90-day supply to be delivered to your home, which will save you the time of making a trip to the drugstore each month. Preventive medications are covered at 100% without a deductible when they are prescribed for preventive care purposes and are obtained at an in-network pharmacy. Immunizations and vaccinations that are recommended by the CDC for children and adults are covered at 100% if they're administered in the physician's office or at a vaccine pharmacy. Please be aware that certain drugs require prior authorization or may have a quantity limitation. To learn more, you may look up specific medications by registering at bcbstx.com. Additionally, you may visit that website to check which pharmacies are in network. You will see a lower copay at the preferred pharmacies listed. Blue Cross Medical members have access to virtual visits from MD Live. Virtual visits can be considered after hours or during holidays or when your family doctor is unavailable for non-emergency needs. Many minor ailments can be treated virtually, such as colds, sore throats, flu symptoms, allergies, sinus infections, ear and eye problems, or even skin conditions. Virtual visits are not for emergency situations like chest pain, abdominal pain, or shortness of breath.
Here's an overview of the costs for the medical plan. These payroll deductions are also listed in your benefits guide and at the Paycom enrollment site.
The dental plan will be offered through Blue Cross Blue Shield of Texas. The dental plan contains a calendar year deductible of $50 per individual and $150 per family. The deductible only applies to services in the basic and major categories and does not apply to preventive or orthodontic services. Basic services like fillings, root canals, and oral surgery are covered at 80% after you've paid your calendar year deductible. This means that you'll have to pay the 20% balance after paying your deductible. Major services are covered at 50%. Major services include things like crowns, bridges, and dentures. There's a 12-month waiting period for major services if you did not have prior dental coverage. These services have a calendar year benefit maximum of $1,000. The vision plan is also administered by Blue Cross Blue Shield of Texas. If you visit an in-network vision provider, you'll pay a $10 copay for exams and a $25 copay for materials. For glasses, the plan has a $130 allowance for frames, and standard lenses are covered after your $25 copay. Lens add-ons such as tint, UV, and scratch-resistant coatings are available for an additional cost. Progressive lenses are also available for an extra cost. For elective contact lenses, you will have a $130 allowance. The plan covers one eye exam every 12 months, and contact lenses are also covered every 12 months. You can choose either contact lenses or glasses under this plan. If you prefer glasses, the plan will cover spectacle lenses once every 12 months and new frames every 24 months. If you visit an out-of-network vision provider, you will have to pay the cost of covered services up front, and then you'll need to submit your claim for reimbursement.
Here are the payroll deductions should you wish to join the vision plan. The rates are also located within your benefits guide and at the Paycom enrollment site.
Opportunities for WBC has established a plan to help you save tax dollars and increase your take-home pay. This is called a flexible spending account, or FSA. An FSA allows you to make contributions from your paycheck on a pre-tax basis. This means that all amounts deducted from your paycheck and contributed toward the FSA will not be subject to federal income tax or Social Security tax. Eligible expenses for a pre-tax FSA plan include medical, drug, dental, and vision claim expenses. You do not need to be enrolled in the medical plan in order to take advantage of the healthcare FSA. If you choose to participate in the healthcare FSA, you will need to designate a total dollar amount that you would like to have payroll deducted and deposited into your account for the 2024 plan year. The maximum amount that you may elect for the 2024-25 plan year is $3,200. Up to $640 of unused funds may be carried over into the following plan year. Your rollover election must be used by the end of the next plan year, or else the remaining balance will be forfeited. You should plan cautiously in order to avoid forfeiting your balance at the end of the following plan year.
Eligible expenses can include deductibles, copays, and coinsurance for medical, drug, dental, and vision expenses. There are also some over-the-counter expenses that you can use your FSA dollars on. Here are some examples of some without the need for a prescription. For some over-the-counter expenses to be FSA eligible, a prescription may be required, and here are some examples. For a complete listing of all eligible expenses, please visit the IRS website and perform a search for Publication 502. Opportunities for WBC provides a life and accidental death and dismemberment plan at no cost to you. The benefit to your beneficiary is $10,000 upon your death. If you pass away as a result of an accident, your beneficiary will receive another $10,000.
You have basic life insurance from Opportunities for WBC, but is it enough for your family's needs? Buying a home or having a baby? It might be time to think about the amount of life insurance that you may need. You may purchase up to 5 times your salary to a maximum of $500,000 in additional coverage on your own life in $10,000 increments. You can also purchase coverage for your spouse to up to half of the amount that you elect for yourself. $10,000 of coverage is also available for each of your dependent children. If you waive coverage for the 2024-25 plan year and wish to join this plan later, evidence of insurability will be required. Evidence of insurability means that you would have to answer a health risk questionnaire and coverage could be denied.
If you become disabled and are no longer able to work temporarily, a short-term disability plan is offered on a voluntary basis. The short-term disability plan will pay 60% of your pre-disability earnings up to $1,000 per week. The benefit begins paying after 14 days of disability due to an accident or an illness. This benefit will be paid up to 11 weeks, providing coverage before optional long-term disability coverage begins. The voluntary long-term disability plan will pay after the short-term disability benefits have been exhausted, or after a 90-day waiting period. This benefit pays up to 60% of your monthly salary, up to $6,000 per month, and will pay up to 5 years. We'll finish up by reviewing some of the additional resources available to you.
Opportunities for WBC provides all employees with access to the Gallagher Marketplace. The Gallagher Marketplace offers significant savings on things like home, auto, renters, boat, and RV insurance, as well as extended vehicle warranties. To learn more, scan the QR code shown here or in the benefits guide. Opportunities for WBC provides an Employee Assistance Program, or EAP, free of charge to full-time employees and their families. This EAP is administered by TELUS Health, formerly LifeWorks, and it provides telephonic access to licensed counselors 24/7 from anywhere in the U.S. You may receive up to 5 free face-to-face sessions with a licensed counselor per household per year. The EAP offers assistance with day-to-day issues so that you can be at your best at work and at home, and all assistance is strictly confidential. Contact information to access the EAP is located within your benefits guide.
If you have questions about your benefits, please contact Gallagher Customer Service. This information is listed on page 1 of your benefits guide. Gallagher has an entire staff of people dedicated to helping you with everything benefits related for you and your family, including claim issues. Please feel free to contact Gallagher's Benefit Advocate Center anytime that you need help with your benefits. If you have questions regarding how to enroll, please contact your HR department. This concludes the enrollment presentation. Please be sure to enroll by the open enrollment deadline or within 30 days of your new hire eligibility.